Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752. And when you phone, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by the lovely Suzanne Summers. What do you think?
I love it. Suzanne Summers, I love you. I hope you're doing great. She has written some of the, I think about 18 books or 20 books about, they're mainly interviews with doctors who do what I'm going to call natural medicine, things that actually help people without hurting them. No medications, no surgery. So God bless you, Suzanne Summers. And besides being a great advocate for natural medicine, Suzanne Summers is just an amazing, loving person. I've known her and taken care of her and her family pretty much since the beginning of my career in medicine. And they're all amazing people. They have her spark and her lovingness. So God bless all of you. So I'm actually looking on my computer right now at x-rays that were emailed to me. And the person says, "Hi, I have a lot of issues and am interested in stem cells and PRP." So I'm looking at these x-rays and they look absolutely fine. But the person goes on to say, "My surgeon wants to operate on my neck and low back. Do you agree?" Well, obviously I haven't examined this person. They're not my patient. But these x-rays don't really tell me much of anything. The person has what we call a loss of lordosis in the neck. The vertebrae do not have the normal curve, and that means the person has a sprain. You know what a sprain is? Tissue is stretched out. Does that mean you get surgery because you have a sprain and it hurts? No. But when it goes to the neck or the back, doctors get real antsy about it. It's a very sexy area to operate on. No, there's so many of these people that come in that have these nothing things that can be healed by just injecting platelets and or bone marrow to regrow the ligaments around there and strengthen them up and thicken them up. But instead, some of them, actually most of them, end up getting a surgery when they don't need it. So be very, very careful. I wish I could share what these x-rays look like to you. But if you ever come in the office, I can show you some of them and show you that it's not really a surgical issue. Now, obviously, if I am a surgeon and I was in training to do that, everything looks like it's a surgery needed. Everything. So we have to be very careful. And again, I'm not putting down the surgeons. But if something looks wrong in the x-ray, even this straightening of the lordotic curve, and the person has pain, that doesn't mean you get surgery for it. It means you try to heal the area, and a lot of these sprains can be healed up. So, you know what I always tell people when they have neck pain or back pain, and a doctor has told them, a surgeon said you need surgery, I say, when I examine them and it's a sprain, I go, "You have a sprained ankle in your neck or back." And they say, "What are you talking about?" And I go, "It's the same thing as a sprained ankle. Do you want to get surgery for a sprained ankle?" And they go, "Of course not." You know, a lot of athletes have had 5 or 6 or 10 sprained ankles, and they say, "I don't know, it just goes away after, 3 to 4 to 6 weeks." Unfortunately, neck and back, sometimes these sprains don't go away for a lifetime unless they're treated. I have had people who have had neck sprains and backs for 50 years, that's 50 years, who have healed up with regenerative medicine using platelets or stem cells. And in the beginning when I did this, I used to go, that was a miracle that it healed. Now it's so common for me to see this that it isn't a miracle anymore. It's just what happens when you inject the area with cells that strengthen the area, thicken up the ligaments. There are a lot of things that surgery is needed for. If you have a giant herniated disc and it's sitting on the sciatic nerve or the plexus that goes to the sciatic nerve, you may need surgery. But I got to tell you this, I have a lot of people with herniated discs who really are not having big problems. For me, and I was in a pretty bad car accident 3 years ago. I was hit at 50 miles an hour and had severe neck pain. Herniated discs, right? Did I get surgery? Nope.
No.
Nope. Did I get injected? Yep.
Yes.
Am I better? Yep.
You're all normal now.
I don't know about all normal, but
Well,
I'm doing
okay, mostly.
My wife doesn't say I'm normal, you know. God bless her.
Well, as your radio wife, I probably have to concur with her. But,
Yeah.
you know.
I know I'm not normal, but I don't know any human who is normal.
Maybe there just is no normal. Maybe it's just a word. Somebody
Yeah.
made it up.
I think so.
Well, if you want to talk to Dr. Darrow about your pain right now, please give us a call at 866-870-5752. Right here in the studio, 866-870-5752. You get your free book, Stem Cell and Platelet Therapy. There's 264 scientific studies in this book, so if you're skeptical, give us a call, get the book, and you'll see. Start reading. What do you think?
So, I think it's time for a question.
Go for it.
All right, the person says, hello, Dr. Darrow. I've been medically diagnosed with osteoarthritis in my left hip, and I expect the same in my left knee. I have some pain and a notable loss of function in that hip. I have both a physically demanding job and lifestyle, both of which are centered around high-level athletics. Sounds like fun. I would like to set up an appointment with you, hopefully for the first of the year, if you're available. My number one question is, how long will the treatment sideline me for work, as I can't really take off much time? Would standing and walking be a problem after a few days of rest? By the way, I'm 55. I'm not overweight and otherwise relatively healthy. I live here in Los Angeles. Thank you, Thomas. So I wrote back to Thomas, and I think he had another reply. Let me see. I sent him some studies on the stem cells and platelets for the hip and knee so he could read about that. And a lot of these studies are on my website, which we haven't really talked about much yet. But the website is www.lastemcells.com. I'll repeat it while you write it down. It's www.lastemcells.com. And there are just endless numbers of studies on it and endless numbers of videos of me doing these procedures, so you can actually watch me do stem cell, bone marrow aspiration, and things like that, and watch me inject different parts of the body and see if it's something that you would like to do. I work on that site every single day of my life. And I have a big staff of people that work on it. We try to keep it very current, add a lot of new information every day. And again, I'll repeat it. It's www.lastemcells.com. And a bonus for the site is that every single page has a spot to email me. So I get emails from all over the world every day, and I answer every one of them. So let me see what this person said as I wrote back. They responded quickly, and they said, thank you for such a prompt reply. Everybody says that. The other thing that people marvel at, my patients marvel at, is I give everybody my cell number. Every patient has my cell phone, and I admonish them, if they don't call me with any issues, I'll be angry with them. The opposite of what most doctors do. Do you know, I have some doctors, and I can't even reach them.
Yeah, exactly.
I mean, it's crazy.
It is crazy.
It's crazy. I have a doctor who's actually, I've known, he's worked with me for years. And I called him 4 weeks ago on a Sunday. Okay? I texted him. I didn't call him. I texted his cell number. And he texted back, "It's Sunday. I don't work on Sundays." He said, "Contact the staff." So I emailed the staff. It's been a month. I have not heard back from them.
Wow.
Do you think I'm going to go back to that guy?
Never.
No. Do I like him? Yeah, I like him. But most doctors have these boundaries, which I don't understand. I didn't go to medical school to get boundaries. I went to medical school to serve people and help people. And I don't get what it is with doctors, and I'm not putting them down. It's just they have this culture of boundaries. Don't bother me. I'm too busy, and I need a personal life. Well, I have a personal life, and a lot of it has to do with my patients. My patients are my friends. So anyway, this guy writes back and goes, "The arthritis in my hip was diagnosed from an x-ray about 2 years ago, and hip replacement is not recommended yet, but will be on the table soon." Well, that's silly. It's not going to be on the table soon. "My knee has not been evaluated, but there's some pain on the medial side," that's the middle side, "during activities. When my doctor diagnosed the hip arthritis, advice was take 3 Advil every time I train." That is a terrible idea. Studies show that when you take anti-inflammatory medicine, hip arthritis accelerates faster. Okay, he goes on to say, which we know is terrible advice. "The only thing I've found to help is the soy avocado," I don't even know what this word is, "which has made a big difference," some kind of supplement, I guess. "I'm not expecting PRP to be a magical cure, but I'm ready to give it a try. Thanks again. I look forward to meeting you." So I get people literally every day with arthritis who are told they need a knee replacement, hip replacement, shoulder replacement. We work on them, and they become pain-free and don't need the surgery. Just because a surgeon or a doctor says you need a surgery does not mean that. I have to keep hammering that in. People don't get it. You don't listen to your x-ray to decide if you need a surgery. You do an examination and you talk to the patient. I have a lot of people who come in with, quote, arthritis, but they have very minimal pain. So what's going on? It's not the arthritis that they have that's causing the pain. It's a strain. We have people that come in with labral tears. Labrum means lip in Latin. I had to take 4 years of Latin. Actually, I loved it. I didn't have to do it. I took 4 years of Latin in high school. So it's kind of cool because most of the medical terms I know have either a Latin or Greek root to them. So I know a lot of the words just by looking at them. But anyway, there's hope for you guys with pain. And I don't treat pain for other reasons than in the musculoskeletal reason. People have strokes and can have pain from that. I don't treat that unless it's also, I do have a woman actually who had a stroke, and because of the weakness in her leg, her knee started hurting, and I think I treated it twice, and she is pain-free in the knee now. So that's a case that I'm backstepping and saying, yes, even with the stroke, there are joint issues that can happen that I can help. I get a lot of people that have had brain trauma, who are in wheelchairs, strokes, other things, and people that are in wheelchairs often burn out their rotator cuffs because they're using their arms constantly to get around, and we can help that too. I actually did a study on that and published it years and years and years ago when I was doing my residency at UCLA. I worked at Rancho Los Amigos Hospital, which is a very amazing hospital for brain trauma and spinal cord injury. That taught me a lot being there. So, Nita, I'm going to go to another question unless you have something to add to us now.
Oh, I just wanted to give the phone number again, 866-870-5752, right here in the studio, and you get your free book, Dr. Darrow's latest Stem Cell and Platelet Therapy.
All right. Here's one that says options to knee replacement. Let's see what's going on. Greetings, Dr. Darrow. I would like very much to speak with an individual regarding knee replacement or treatment, any potential options at this time. Well, knee replacement's at the bottom of the list as far as I'm concerned. I think I may have sent one person or two people in my entire career for a knee replacement, and that's when that knee was so arthritic or smashed or broken that there was nothing left to it. But generally, we can help people where doctors say they need a knee replacement. Typically, what we do, if there's arthritis, we'll inject platelets from the blood or bone marrow aspirate, which has platelets and stem cells in it, and we get great results with that. A lot of you know my story. Back during the heavy COVID time, when we couldn't use golf carts, we had to walk. And I play at a golf course that's called Mountain Gate. And as an acronym, we call it Mountain Goat, because you got to be strong to climb those hills. It is in the mountains behind the Getty Museum in LA, and it's a tough walk. I've done it many times. And during the time during COVID, when we were not allowed to use golf carts, to ride in them, which almost everybody does there. There's very few people that will walk that course because it's just so hard. It's so up and down. There is not one flat lie, not one on the course. So anytime you're hitting the ball, you're hitting, from an angle, and which is fun for me. I like that. I don't like regular flat golf courses anymore after playing this course. You have to calculate in your head. And I watch my brain as I'm getting ready to hit a shot. There are so many calculations that I do before I hit that ball, right in the middle of the swing even, because it's such a complex course. But at any rate, I was using a push cart and pushing up and down the hills, and we have what's called kikuyu grass, which is very thick. And it's getting harder and harder to push, and I'm pushing and pushing. And I was running every day in the mountains where I live, and all of a sudden my knee just went boom, and I couldn't walk anymore. I literally quit and limped off the course, drove down to my office, which is right down the hill across from UCLA on Wilshire Boulevard, and I put an ultrasound on my knee, and I had 45 cc's of fluid that I saw inside the joint, and I knew I was ski-rooed. So I injected it with platelets and stem cells 4 times in 1 week, and guess what? I'm good. I saw a meniscal tear. It's gone. My knee is almost 1,000% healed. I still baby it a little bit because some of these things you have to take care of. They're sort of weak spots in the body. I have a few of them from over-exercise, being a gymnast and wave skier, surfer. To me, sports is where it's at. I love sports. I'm 73, but it's rare a day that goes by that I don't do some sports. When it's raining out, I have a push-up bar in the house. I have an ab program to get my 6-pack going more. Most people have a 1-pack. I still am working for a 6-pack. I do mostly a keto diet, so I'm skinny. I'm about 6 feet and about 165, anywhere from 162 to 165 pounds. And a lot of my patients are like that too. But, guys like us get a lot of injuries. It's just part of doing sports. And a lot of us come back. I've had patients who have come back for over 20 years who have re-injured themselves because they're so active. But it doesn't stop them from doing sports. And I admonish everyone. I think I told this story once where I was running in the mountains here where I live with my husky dog, Bella. And there was a couple who was ancient looking, and I stopped and talked to them. They were hiking. They had those ski pole type things to hike with because they needed it for their balance. And I said, God, it's so great that you guys are hiking. How old are you? And the woman spoke up and said, I'm 90 and my husband's 92. And I said, how often do you do this? And they said, we do this every single day. And then the man said, and you better start doing it every single day too if you want to stay young. And I was like so enamored with this couple because they know the key to life. The key to life, to me, is staying young. How do you do that? You think young things, you stay happy. I meditate an hour every day to go to that happy place, and then I do my best to bring it out. And, I always say this to my patients. They go, how do you stay so happy all the time? It's not like you're a doctor. And I go, because when I walk in the door of my office, I put on my Superman cape, and my personal life disappears. I am here for my patients. And like I said, everybody gets my cell number. I have some patients who actually text me every single day. When I put people on a ketogenic diet, I want to know how they're doing. And they tell me their weight every single morning. If they haven't lost weight that day, I make them text me what they ate so we can figure out what it is that is blocking them from healing their weight issue. So at any rate, let's see here what's going on, Nita. I'm going to tell you again about the website, which is www.lastemcells.com. Watch me on the videos of me doing the injections for regenerative medicine of healing the body all over. And I'm going to go to another question, if you don't mind, Nita. Anything else for you?
No, hit it.
Hit it. Boom, bada boom, bada boom. This says lower back issues. Okay, let's see. Would like a consult. Have been genuinely impressed with your radio information, Dr. Darrow. My problem is lower back at L4-5 vertebrae. I have neuropathy in both legs and feet. I saw 2 surgeons through Loma Linda University Healthcare. They would use plates and screws to stabilize my spine. Quite frankly, I believe your procedure makes much more sense for true recovery and wellness. Thank you. And he gives his name and number, and we already spoke to this nice gentleman. So yeah, I'm with you on this thing. And just because an X-ray MRI shows that there's a problem with the vertebrae doesn't mean there's a problem with the vertebrae. Neuropathy in the legs and feet can come from other things than the vertebrae. It can be from too much alcohol, too much carbohydrates. Yeah, that's right. Over obesity, diabetes, type 2 diabetes. A lot of people have it, don't know it. But if you're overweight, drop it. Real important to be skinny. If you want to be healthy, you want to live long, the only studies we know that actually give extra years of life are people that are on very low carbohydrate diets. They live about 8 to 10 years longer. If you've got type 2 diabetes, you are cutting off years of your life. That's what the studies show. So to me, it's simple. People go, it's so hard. I can't give up my wine. Give it up. Give
My
it up
chocolate.
Well, you can get chocolate with no sugar in it too, Nita.
That's true. That's true.
And it tastes pretty darn good. Over the years, I have learned to eat, what's the bittersweet chocolate. I love it.
I do
There's
too.
hardly any sugar in it. And I will buy chocolate with no sugar in it, no carbs. There's other types of sugar in it that don't raise up your insulin. Okay, so that keeps you healthy. So yeah, you can eat all the chocolate you want, and just keep it to the kind that doesn't have the high sugar in it. Stay away from carbohydrates. So another issue here, when this person says my problem is a lower back at L4, L5 vertebrae, that doesn't mean that the show's over. We love you all. Give us a call at the office, 800-300-9300. I'll repeat it for you. I'm waiting to hear from you at the office, 800-300-9300. And go to the website, www.lastemcells.com. Thank you, Nita, Suzette, Alex, and the rest of the staff. We all love you so much.
And we'll see you next time. Thanks.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.